Hello to my fellow PT and OT practitioners. My name is Christine Hellstrom and I'm an occupational therapist. I want to talk to you a moment today about some complementary therapeutic interventions for inpatient acute care that might spark some interest. And let's just say it involves animals. Are you suffering from burnout? Do you cross your fingers before entering a patient room anticipating the dreaded patient refusal to participate in your treatment session? Do you find yourself begging the patient to take a walk or do some exercises? Do you find that you're constantly putting on a smile and cheering for the patient to get up and move? Trust me, you're not alone. It can be extremely difficult to motivate patients to participate, and therapists all over the nation are suffering from cheerleader fatigue. But what if I told you there's an intervention technique that may help with patient motivation and participation? Interested? Of course you are. Let me tell you about animal-assisted intervention. Animal-assisted intervention is defined as a goal-oriented and structured intervention that intentionally includes animals in health, education, and human services for the purpose of therapeutic gains in humans. It involves people with knowledge of the people and animals involved. It's an umbrella term for a variety of interventions such as animal-assisted activities, animal-assisted education, animal-assisted coaching or counseling, and animal-assisted therapy. Animal-assisted activities are interactions or visitations conducted by the human-animal team for motivational, educational, and recreational purposes. An example would be visiting companion animals for meet and greet activities with residents in nursing homes. Animal-assisted education is conducted by qualified general and special education teachers, either in a group or individual setting. The focus of the activities is on academics, social skills, and cognitive functioning. An example would be a child reading to a dog. Animal-assisted counseling is delivered or directed by a formally trained professional or coach counselor with expertise within the scope of the professional's practice. AAC focuses on enhancing growth and personal skills of the recipient, on insight and enhancement of the group's processes, or on social skills or social emotional functioning of the clients. Animal-assisted therapy is directed and or delivered by health or human service professionals, including PTs and OTs. Intervention progress is measured and included in professional documentation. AAT is directed by a formally trained professional, and it focuses on enhancing physical, cognitive, behavioral, or social emotional functioning of the particular human recipient. Now, there are a variety of ways in which animal-assisted interventions can incorporate a partnership with animals. These can be categorized as implicit, explicit, and instrumental. With implicit AAI, clients are either observing or simply being in the presence of animals. An example would be a fish tank in a hospital setting containing several colorful fish to be placed in a space surrounding the nurse's station. These fish may assist with helping patients to direct their attention outward and focus externally. With explicit AAI, clients demonstrate simple contact with an animal or are being directed to observe. Animals are passive therapeutic agents. Animals help to enhance rapport, focus, or outward attention. An example would be in a long-term care nursing facility, a long-haired rabbit introduced to the residents in a controlled manner or during an afternoon activity session. With instrumental AAI, clients and animals participate in directed activities and interventions. Animals are active therapeutic agents providing opportunities for meaningful interaction. Intervention is focused on skill building and developing or practicing of new behaviors. The patient may be encouraged to reach for and throw a ball for the animal to retrieve, with the goal being increased range of motion of the patient's upper extremities. There are so many examples. Now, instrumental intervention is the type that I propose we use in the hospital setting. Let me introduce you to the proposed facility animal, Frankie. Facility animals are expertly trained animals who partner with a handler working in a healthcare, visitation, or educational setting. If employed by Carey Medical Center, Frankie could be partnered with during PT and OT treatment sessions. As Frankie's handler, I would be present during your sessions and provide observation and care for Frankie while you carry out your therapy session. I would also intervene in the progression of the session if I notice behaviors being displayed by Frankie that could indicate stress, anxiety, and overall compromised welfare of Frankie and the client. Now, Frankie is not your typical dog. Most companion animals, or pets as we call them, are not appropriate animals to partner with during AAI sessions. As a therapy dog, Frankie has received extensive training and has met certification standards in order to be deemed appropriate to participate in programs. Frankie has a calm temperament, he follows commands well, he has been desensitized to loud environments and moving hospital equipment. He is an A1 superstar. You might wonder how Frankie was trained. Traditional training methods using aversive stimuli such as positive punishment or negative reinforcement tend to have negative effect on animal welfare. You would never want to hit an animal or put a choke collar on them. Instead, Frankie was trained with a focus on positive reinforcement and desensitization techniques. When focusing on positive reinforcement as a training method, it allows the dog and handler practitioner to be having a faithful relationship with the animal with desired behavior as an end result. It's important to note that the welfare of the animal increases significantly when positive reinforcement is the preferred training method. Now, how can animal-assisted therapy benefit a patient in an acute care hospital setting? Well, case studies have shown that introduction of animals into a session result in increased patient motivation to participate, improved ambulation speed and distance, decreased heart rate, improved range of motion, balance and endurance, decreased perceived rate of pain, improved functional self-care, and improved communication skills. How amazing is that? Now, anthrozoology is defined as the study of interactions and relationships between humans and non-human animals. I know you're excited to work with Frankie and I, but before we jump right into a session, I would want to talk with you as the practitioner and get an understanding of the goals of the proposed therapeutic intervention. I would want to decide if partnership with an animal during therapy would be beneficial, and I would even want to discuss with the client possible benefits of partnership. I would want to be aware of the view the patient has on the species and the knowledge of their past experiences. These screenings should be implemented to match the proper animal for the anticipated therapeutic outcome and intervention. Screening should also be implemented to match the proper animal to the client involved. For example, if the client is allergic to dogs, a hypoallergenic option should be considered. Or if the client is demonstrating failure to thrive in low levels of mobility and endurance, partnership with a large, high-energy dog should be avoided. Clear roles and expectations for those involved need to be outlined prior to the start of the intervention session. If the animal and or client do not appear to be bonding during a session, such as the animal is cowering or the client is not interacting with the animal should be removed from the session. However, you can continue with your physical therapy and occupational therapy treatment. Now, just so we're all clear, anthropomorphism, objectification, and instrumentalization during AAI will not be tolerated. Anthropomorphism is the attribution of human traits, emotions, or intentions to non-human entities. It can be extremely dangerous for the animal involved. For example, animals may suffer malnutrition due to humans feeding them people food instead of a balanced dog kibble. Dressing dogs in clothing can lead to thermoregulation issues. Transporting animals in baby carriers can lead to restricted physical activity and freedom of movement. An application of hair or fur dyes, nail polish, or colognes can lead to systemic issues. Objectification is the act of treating a person or an animal as an object or a thing. And instrumentalization is the act of serving as an agent or a tool. They can lead to poor welfare issues for the animal. Animals are not objects or tools that can be used. Look at this little guy. Instead, they're living beings with physical and emotional needs. They should enter a partnership with a handler, practitioner, and client within an appropriate environment, and they should be protected at all times. Frankie and I would love to partner with you during your PT and OT treatment sessions. I think we would all make an excellent team with the intent of having your patients participate in therapy and make the gains in order to meet their plan of care and their progress goals. And just look at the faces of this patient and this dog. I think we can all agree that they're both loving the process. Thanks for joining me on my presentation. I hope we get to work together in the future.